What is Bezremy? Bezremy injection is a prescription medicine that is used to treat adults with Polycythemia Vera. Please see additional important safety information at the end of this video and full prescribing information, including boxed warning and medication guide, available at BESREMi.com.
Hi, I'm Anna.
And I'm Mike. If you're watching this, your healthcare provider has prescribed Bezremy. And if you're like me, you'll want to know everything about how to use the BESREMi Pen.
We want to walk you through the process so you feel confident and assured when you begin using the Bezremy Pen at home.
Remember, this video does not contain the complete instructions, so please take a moment to read the full instructions for use and prescribing information that comes in the box with your Bezremy.
And remember, watch the video from start to finish before using the Bezremy Pen for subcutaneous injection at home. Feel free to watch it again to become more familiar with this process.
We'll start the demonstration shortly, but please take note of these important safety instructions first. Store the Bezremy Pen carton in the refrigerator between 36 to 46 degrees Fahrenheit, 2 to 8 degrees Celsius. Store the Bezremy Pen in the original carton. Do not freeze the Bezremy Pen. Keep the Bezremy Pen, needles, and all medicines out of the reach of children. Important information you need to know before injecting Bezremy Pen. Your healthcare provider will tell you the prescribed dose that you should be taking. Each time you inject, be sure that you know the prescribed dose of Bezremy to inject. Your dose may change over time. Bezremy pens and needles are for single use only. A single safety needle is provided with the pen and cannot be removed from the pen after attaching. Do not reuse. Bezremy is for subcutaneous, under-the-skin injection only. Do not inject into a vein. Inject Bezremy into the lower stomach area or top of the thighs just under the skin. Do not inject Bezremy into any other area of the body.
All right, ready, Mike?
I'm ready. Place the Bezremy pen carton on a clean surface for 15 to 30 minutes to allow it to come to room temperature.
There is no other safe way to warm up and prepare your Bezremy Pen.
While the carton is adjusting to room temperature, it's a great time to gather your other supplies and wash your hands. Don't forget to always check the expiration date on the carton to confirm the medicine is still usable.
Pull the pen cap straight off the pen and throw it away. And make sure you take a good look at the pen to ensure it's not damaged or broken.
Important. You also need to check the liquid medicine inside the pen. The liquid should appear clear and colorless, maybe even slightly yellow in color.
Your prescribing doctor has probably gone over this part with you, but it's important. There are two possible injection sites: your lower stomach, at least 2 inches away from your belly button, or the top areas of your thighs.
And it's important to rotate injection sites.
Right, to avoid the buildup of tissue, which can make it harder for your body to absorb your medication.
Once I've chosen my injection site, I'm going to clean it with one of the alcohol swabs I set out earlier and let that air dry.
Now, to prepare the connection between the pen and the needle, you'll take another alcohol swab and clean the rubber stopper on the tip of the pen. Then peel off the protective seal from the needle before pushing the capped needle straight onto the Bezremy pen until it snaps. Then, turn the needle in either direction until it clicks. The needle is attached when it does not turn freely.
Now pull off the needle cover and throw it away.
Next, we call this the flow check. Point the needle up and turn the dose selector until the liquid drop symbol is centered in the little window.
Now, press and hold the injection button all the way in until the dose window returns to 0.
You will need to repeat the flow check 3 more times. After you've done this flow check 4 times, you should see liquid medicine at the tip of the needle.
Now, set your dose by turning the dose selector until your number is centered in the dose window.
It's normal to hear a clicking sound while you dial to the correct dosage.
And always double check to make sure the number in the dose window is the correct dose before giving the injection.
Mike is going to demonstrate how to inject now. First, hold the pen over the area you chose as your injection site, the same area you just cleaned with the alcohol swab. Make sure you hold the pen at a 90-degree angle and that the full length of the needle goes straight into the skin.
Like this.
Once the needle is inserted, press the injection button all the way down until it stops, and the dose window shows 0.
But we're not done with the injection yet. Once you see that 0, hold the needle in place while counting to 5 to make sure the full dose is delivered. Now, lift the pen straight out and dispose of it with the needle still attached directly into an FDA-cleared sharps disposal container right away, even if there is still liquid in the pen.
Remember, do not attempt to reuse the pen.
See instructions for use at BESREMi.com for more information.
It's normal to see a small amount of blood or liquid at the injection site after you take the needle out. Just press your gauze or cotton ball over it until the bleeding stops and apply a small adhesive bandage.
If you have any questions, please reach out directly to your care team. Thank you for watching.
Read this important safety information carefully. It explains the serious risks of Bezremy and how to take it safely. Talk to your healthcare provider if you have any questions. What is the most important information I should know about Bezremy? Bezremy can cause serious side effects, including conditions that may cause death or may worsen certain serious diseases you may already have. If symptoms get worse or become severe and continue, your healthcare provider may tell you to stop taking Bezremy permanently. These symptoms may go away in some people after they stop taking Bezremy. Mental health problems, including suicide. Bezremy may cause mood or behavior problems that can get worse during treatment or after your last dose, including irritability, getting upset easily, restlessness and agitation, confusion, depression, feeling low, hopeless, or bad about yourself, unusually grand ideas, acting aggressive or impulsively, thoughts of hurting yourself or others, or thoughts of suicide. If you develop any of these symptoms, call your healthcare provider immediately. New or worsening autoimmune problems. Bezremy may cause your immune system to attack healthy cells, leading to conditions such as thyroid disease, increased blood sugar, hyperglycemia, or type 1 diabetes. Call your healthcare provider if you experience extreme tiredness, frequent urination, excessive thirst. Heart problems. Bezremy may cause heart problems, including cardiomyopathy, heart muscle disease, heart attack, irregular heartbeat, atrial fibrillation, decreased blood flow to the heart. You should not take Bezremy if you have uncontrolled high blood pressure, congestive heart failure, a serious abnormal heart rhythm, narrowing of the arteries to your heart, certain types of chest pain, angina, a recent stroke or heart attack. Who should not take Bezremy? Do not take Bezremy if you have or had severe mental health problems, especially depression, suicidal thoughts, or attempted suicide, have or had a serious or untreated autoimmune disease, are allergic to interferon or any ingredient in Bezremy. Symptoms may include itching, swelling, trouble breathing, dizziness, or chest pain, have certain types of liver disease, have had a transplant, and take immune-suppressing medication. Before using Bezremy, tell your healthcare provider about all of your medical conditions, including if you have any of the following: a mental illness, type 1 diabetes, heart or bleeding problems, problems with your immune system, hepatitis B or HIV infection, kidney or liver problems, are pregnant or planning to become pregnant. Bezremy may harm your unborn baby. Use effective birth control during treatment or for at least 8 weeks after your last dose. Bezremy may affect your menstrual cycle and could stop your periods. Do not breastfeed while taking Bezremy. What are the possible side effects of Bezremy? Serious side effects include low blood cell counts. Taking Bezremy can lead to infections, anemia, or bleeding problems. Call your healthcare provider right away if you develop weakness and tiredness, bruising easily, nosebleeds often, fever, chills, burning and painful urination, urinating often, or coughing up yellow or pink mucus, phlegm. Serious allergic reactions. Get medical help right away if you get any of the following symptoms: skin rash or hives, itching, swelling of the face, eyes, lips, tongue, or throat, trouble breathing, chest pain, or feeling faint. Eye problems. Bezremy can cause severe eye problems with your retinas that can lead to vision loss or blindness. You should have an eye exam before and during treatment with Bezremy if you have diabetes or high blood pressure, and also have retinal problems. Liver problems. Bezremy can cause increases in liver enzymes and liver damage. Your healthcare provider should do blood tests to monitor your liver enzymes and liver function before you start and during treatment with Bezremy. Kidney problems. Your healthcare provider will do blood tests to check your kidney function before starting and during treatment with Bezremy. Tell your healthcare provider right away if you develop any symptoms of a kidney problem, including changes in the amount or color of your urine, swelling in your ankles, blood in your urine, or loss of appetite. Tooth and gum problems. Bezremy can cause tooth loss and/or dry mouth. It is important for you to brush your teeth well, 2 times each day, and have regular dental examinations during treatment with Bezremy. Skin reactions. Bezremy may cause reactions such as rash, itching, and hair loss. Increased triglycerides. You may require blood tests to monitor levels. The most common side effects of Bezremy include flu-like symptoms, including tiredness, weakness, fever, chills, muscle aches and joint pain, itching, sore throat. These are not all of the possible side effects of Bezremy. Call your doctor for medical advice about side effects. You may report side effects to Pharma Essentia at 1-800-999-2449 or FDA at 1-800-FDA-1088.